Expand yourself, get yourself out of your comfort zone because success is not a comfortable procedure. So start putting pressure on and focus on your dreams. Hi all, this is Ruth from Tiju's Academy and welcome to another video. In speaking, we have two criteria, linguistic criteria and clinical communication criteria. In clinical communication criteria, we have a point called incorporating patient's perspective. So today in this video, we are going to discuss about how to incorporate patient's perspective. While incorporating patient's perspective, a nurse should focus on to accept patient's concern. It might be different from your professional knowledge. So what you should do is to demonstrate that the patient has been heard. Like we say, there are always two sides to a coin. So here as well, we have got two sides. One is a good practice that a nurse should follow and another one is a bad practice that can have a negative impact. So we will start with bad practice. Bad practice involves dismissing patient's concern, being rude about and dismissing inaccurate information. For instance, you are speaking to a patient who is having some weight loss problem, and if he or she is saying, "Nurse, my skin is so loose and unattractive now that I have lost a lot of weight." And as a nurse, if you are saying that is not as important as getting your blood pressure controlled, so it means you are not listening to patient's worries, and that is somewhat a bad practice. If a patient is saying, "I feel very unattractive and I have read about partners leaving if one of them start to lose some weight," and if as a nurse you are saying that should not be your main focus, your health should be your main focus, so that is somewhat rude and you are not listening to the patient's worries. So that is some examples of bad practices. So now let's discuss about good practice. Good practice involves listening to patient's concern, picking up on cues and being non-judgmental. Let's see an example. If a patient is saying, "Nurse, my skin is so loose and unattractive now that I have lost a lot of weight." So in good practice, a nurse should respond in this way. That often happens, but it is something that can be addressed. So in this way, you're listening to patient's concern and as well as providing treatments for their conditions. And if a patient is saying, "It makes me feel very unattractive and I have read about partners leaving when one of them start to lose weight." So as a nurse, you should say, "Are you been having difficulties with that at home? Why don't I set up a referral to a cosmetic surgeon and for you and your husband to a counselor?" So this is how you should incorporate a patient's perspective. I hope this video was useful to you and we will see you again with another video.